I want to share a case that perfectly explains why gut health is so important for mood, behavior, and focus, especially when medications aren't working. My name is Dr. Anne-Marie Barter. I'm a functional medicine doctor and chiropractor. I've helped thousands of people regain their gut health naturally. One of my patients came in, he was having very angry outbursts, mood dysregulation, very severe focus problems, and having a very substantial bowel movement every couple days. He is currently under the care of a psychiatrist and on multiple medications. They've tried a lot of different things for focus in the medications and none of them seem to be working. In the treatment room where we reviewed the stool testing, he couldn't sit still for more than a minute without getting up and moving around the treatment room. His caretaker is completely and utterly exhausted. When we ran stool testing and blood work, the picture became very clear. He had massive bacterial overgrowth, maybe arguably one of the worst stool tests I've ever seen. He had 20 species of bacteria that were severely overgrown in his gut. He had low good bacteria, leaky gut. That means that his immune protection was really low, meaning that these organisms were being able to cross into the bloodstream, potentially irritating his nervous system. On top of that, on blood work, his hemoglobin A1C is at 6.4. Hemoglobin A1C is a measure of your glucose over a 3-month period. 6.4 is a very high hemoglobin A1C, which means that your blood sugar is elevated into the diabetic range. Blood sugar instability alone can cause irritability and poor focus, and it also is going to continually feed that bacterial overgrowth. The gut produces most of your serotonin, 50% of your dopamine, and there is also a gut bacteria that produces GABA, which is your calming neurotransmitter. So all these neurotransmitters are going to certainly be low in his gut, no matter how many medications you try. You have to fix the gut and you have to stabilize the blood sugar, especially when medications aren't working. So in this case, we are starting low and slow, starting with microbe support, and we're doing some small changes to actually stabilize the blood sugar. One of my favorite things to do is a CGM, or a continuous glucose monitor, to see what is actually the problem in your lifestyle so that you can see it in real time. In this situation, we are doing a CGM, continuous glucose monitor, and microbe support to lower down that bad bacteria. The next phase, we are going to start to work on rebuilding the gut, but we want to go low and slow in this case.